to my office. I've been asked a bunch of questions since posting the video on alcohol use disorder, and I haven't really responded to them. So here I am, we're about to do that. I'm not sure how long this will be, but anybody who's interested in alcohol use disorder or alcohol use post-bariatric surgery, this video, probably for you. Bariatric surgery changes how the body metabolizes alcohol, which leaves you more susceptible to alcohol use disorder, period. The mechanisms by which weight loss surgery increases the risk for alcohol use disorder have been studied, but they are not fully understood. But there isn't just one culprit. There are things coming from multiple directions: metabolic, anatomic, neurological downstream changes. And a new study basically outlined that one of the surgeries in particular puts you at a greater risk than any of the others, and that's gastric bypass. It actually found that the mortality benefit that we gain, so the extra life that we gain from having weight loss surgery, is almost completely lost. And I'm just going to use that opportunity to say to any of the surgeon's office listening out here that this is yet another reason why we need more patient pre-counseling, alcohol-specific counseling, and stressing the importance of careful patient selection. Not everybody is right for weight loss surgery. A basic understanding of each surgical procedure is kind of necessary to understand how the alcohol will affect you afterward. With R&Y, the stomach is divided into a small proximal pouch and a large distal remnant. So your whole stomach still is in there and just divided into two. That new little gastric pouch is then connected directly to the limb. This is going to bypass that distal stomach, the rest of your stomach, so that's floating on its own now, and also your duodenum. As a result, there's a shorter distance, so things transfer much faster. It's like an express train versus a locomotive. Vertical sleeve gastrectomy involves basically stapling, kind of like a banana, along a line from the pylorus. And this just results in like a narrower kind of tube-like, I'm putting a picture up here, tube-like stomach, but everything's still kind of there. They've just removed a part of the stomach. So it's not a malabsorptive surgery like gastric bypass is. So the lining of your stomach actually contains an enzyme that breaks down alcohol. And after weight loss surgery, obviously you have less stomach, you have less of this enzyme. So drinking wine, liquor, beer, any alcohol is going to expose you to a much higher dose because it is unmetabolized. The enzyme doesn't have as long to metabolize the alcohol, so it's kind of like a direct shot. But after a gastric sleeve, the pyloric valve is still going to slow that down a bit. But with gastric bypass, the surgeon reroutes the small intestine and reattaches it to the small stomach pouch, bypassing that pyloric valve entirely, friends. As a direct result, drinking alcohol after a gastric bypass surgery can lead to extra high levels of alcohol. Moreover, the anatomic changes that result from both VSG and gastric bypass result in higher first pass metabolism and faster gastric emptying. So as a direct result of this, blood alcohol level is going to peak faster and at higher concentrations with both surgeries. There have been studies that show the oral bioavailability of alcohol actually increases by up to 30%, and that's in VSG patients. But there's another study for gastric bypass patients that indicates faster and larger alcohol changes in those who have had gastric bypass as well. In that study with the gastric bypass, they had them consume 26 grams of alcohol, so the equivalent of 2 shots. The blood alcohol level of the gastric bypass patients after those 2 shots was well above the driving legal limit in the US in under 10 minutes. And I mean, just from my experience, patients subjectively can feel this. It's palpable. They report it all the time. The alcohol hits them harder and faster. And I've heard people say, ooh, metabolic changes before, but nobody ever explains what the heck that means. So what are the metabolic changes that are contributing to alcohol, since we've covered all the other ones? So this arises from alterations to how we secrete our gut hormones after both surgeries. Specifically, let's talk about ghrelin, because it has been extensively studied and there are many, many correlations between it and AUD, or alcohol use disorder, post-bariatrically. It is thought that the hormonal changes will change your reward-seeking pathways. A heightened response to alcohol in your central reward center, GHSR. GHSR is another growth hormone receptor, and it's suggested that Alcohol misuse after gastric bypass could be related to this as well, because it's linked to changes in the brain's reward system pathways, including enhanced dopamine sensitivity. So subsequently, this is going to increase the reward that you get from alcohol. All of these factors combined, and this isn't even all of them, are going to these are going to cause increased sensitivity and lower tolerance. And as it's so pervasive that there is an increased risk of ALD after bariatric surgery as a result of the AUD, alcohol use disorder. Sorry, that's liver disease. Obesity and alcohol have a synergistic effect on the liver. People with a BMI over 35 are actually more likely to develop liver disease from any amount of alcohol. And just as a PSA, the patients that typically progress to needing a liver transplant post-bariatric and post-alcohol use disorder are young, they're female, and they're more likely to have an undiagnosed mood disorder. So here's my PSA. If you're gonna have bariatric surgery, you also need to have a therapist. You need to have one when you're deciding. So I've said it before and I'll say it again. If you're gonna have bariatric surgery, you're committing to change your health. You're not committing to lose weight. Alcohol is a poison. That's why you feel drunk. That's your body reacting to the poison that you've put in it. I haven't even touched on the mental health outcomes, the transfer addiction in this video. I haven't talked about the increased risk of ulceration. I haven't even mentioned that approximately 33% of all weight loss patients will struggle with transfer addiction. It will never make sense to me why you would choose to have a surgery that does put your life at risk. It alters how you will live for the rest of your life, and then you choose to pour poison on it, knowing that it's a high-risk activity for you, knowing what it's doing to your body, and quite frankly, knowing that there are 1,000 better ways to alter your state if that's what you're looking to do. Alcohol is the lowest form of high, and it is not good for you post-bariatrically, period. I can find no beneficial reason, physiologically or mentally, to do something post-bariatrically. I find it hard to logic my way into why other people would. It feels like an old habit that refuses to die. It feels like a way you used to know how to socialize that you haven't transformed yet into your new, healthier lifestyle. Because you know it's bad for you post-op. And for some people, it's really bad. It's not a maybe I shouldn't type of thing. You should not. I'm also someone who has to do everything the hard way, right? I have to learn myself, and I get that. If that's you, do that. But I'm just stressing to you, be careful. Be so careful. It peaks at about 2 years out for most people, and nobody sees it coming. Not one person I see who has an alcohol use disorder thought to themselves they would be the person with an alcohol use disorder. I just need people to know that. The prevalence of alcohol use disorder is increasing across the population in general. 10-minute video. I think that answers everybody's questions that were asked after the last video, but man, guys, if I could, I would just say avoid it. There's no need for it. And if anybody has any more questions on it, shoot me a line. If anybody wants to know any alternatives, DM me. Take care of you guys.